The Niagara Health System and Niagara Emergency Medical Services recently launched a public education campaign called When Minutes Count, Right Choice, Right Care.
The main message is if you need to use 911, call 911 for the appropriate types of emergencies. I think the other part of the message is you should understand what an emergency is. Make sure that you get first aid and CPR training so you can be the first responder and better recognize emergencies. But during the actual move of the hospital, we will prioritize patients. We'll get patients through the 911 system in terms of assessment, prioritization, and having our dispatchers talk them through emergencies. And the paramedics will do the appropriate care and treatment, transportation. There should be no challenges in terms of the actual hospital move for patients that are arriving for care.
Key to the campaign is awareness about the changes taking place on Sunday, March 24th at 6 a.m. when the new St. Catharines site opens and emergency and urgent care services in St. Catharines move to this location from the General and Ontario Street sites. There will be no change in location, hours, or services at emergency departments in Niagara Falls and Welland or at urgent care centers in Fort Erie and Port Colborne.
Well, certainly at the legacy site at St. Catharines, if they arrive at 4 o'clock in the morning, as I understand from the NHS, there'll be absolutely business as usual. The patient will arrive at the hospital, they'll be triaged, they'll be assessed, and treatment will be initiated within the legacy site. If they arrived at 5:59, 1 minute before the actual move starts, they'll be treated exactly the same way. If they arrive after that time frame, they'll probably be transported by ambulance or by other means, if appropriate, to the new site.
Sanderson says concerns regarding EMS response times or availability on March 24th are being addressed.
To be clear, we normally staff in peak daytime staffing about 26 ambulances across the entire region. On that day in particular, we're going to have at least 10 more ambulances staffed with paramedics, as well as paramedic teams inside both the legacy site and the new site to help facilitate moving the patients to the appropriate area. For the most part, our ambulances will be transporting patients from the legacy site that are in the critical category, or they're calling it the red stream. We'll be doing it as much as we can in terms of a door-to-door transport rather than the bed-to-bed transport, and allowing transport teams within the sites to move the patients from the doors. That will keep our vehicles on the road as much as possible, moving the patients back and forth. We expect it'll be finished within probably a 4 to a 6 hour time frame.
For detailed information regarding the campaign, visit minutescount.ca. In St. Catharines, for The Source, I'm William Kelly.